Welcome to this lesson on the role of non-specialists in delivering mental health care. In the previous video, we explored the mental health gap, the wide divide between those who need mental health care and those who receive it, especially in low and middle income countries. Now we turn to a powerful truth. Non-specialists can help close that gap. But what exactly do we mean by non-specialists? A non-specialist is anyone who provides support for mental health without being a trained psychiatrist, psychologist, or mental health nurse. This includes community health workers, teachers, clergy, traditional healers, NGO staff, caregivers, law enforcement, and even you, if you are in a position to support others. And this approach isn't just helpful, it's essential. Why are non-specialists so important? The answer is simple. There are not enough mental health professionals to go around. In some countries, there may be just one psychiatrist for hundreds of thousands of people. And even where specialists are available, they are usually concentrated in urban areas and hospitals, far from where most people live. That's why the World Health Organization, through the Mental Health Gap Action Program, encourages task sharing, training non-specialists to identify, support, and refer people with common mental health conditions like depression, anxiety, and substance use disorders. Let's pause and reflect for a moment. Do people in your community know where to go if they're feeling overwhelmed, anxious, or deeply sad? And if they come to you, would you know how to respond in a safe and supportive way? These questions highlight just how valuable your role can be. What can non-specialists do? With basic training and support, non-specialists can recognize early signs of mental, neurological, and substance use disorders. Offer basic psychosocial support like listening, encouraging healthy coping, and connecting people to resources. Provide follow-up and encouragement for those on treatment. Educate others, reduce stigma, and promote mental well-being in their communities. And when needed, refer people to higher levels of care. Let's take an example. In a village in northern Nigeria, a young mother named Zainab has stopped caring for her baby. She cries often and says she feels like a failure. There's no mental health clinic nearby. But a trained community health extension worker recognizes the signs of postpartum depression. She listens to Zainab with empathy, encourages her to talk, educates her family, and helps her access care through a nearby primary health center. That health worker is not a specialist, but she's a lifeline. But does it actually work? Yes. Evidence from countries like Nigeria, Uganda, Pakistan, and Ethiopia shows that when non-specialists are trained and supervised properly, they can provide care that is both safe and effective. People recover, stigma decreases, communities become stronger and more supportive. And most importantly, mental health care becomes something that's no longer locked inside distant hospitals. It becomes something within reach. What support do non-specialists need? Of course, non-specialists can't do it alone. To succeed, they need training based on simple, evidence-based tools like the MH-GAP Intervention Guide, ongoing supervision and mentorship, clear referral pathways to specialists and emergency services, and most of all, encouragement and respect for the important role they play. In summary, non-specialists are not replacements for psychiatrists, but they are an essential part of the solution. They extend the reach of mental health care. They meet people where they are. And they remind us that you don't need a title to make a difference. In the next lesson, we'll explore how this approach is being put into action through the World Health Organization's Mental Health Gap Action Program and how it's being implemented in countries like Nigeria and across other low and middle income settings. Let's continue learning, because the more we understand, the more we can support.